Hi, my name is Kiara Cushing. Today I'm going to tell you about an ongoing crisis in Vermont. Imagine waking up feeling the burden of constant sadness and dread, while having to go to work for barely enough money to live. Now, what if you wanted to get help so you don't feel the never-ending depression, and you're getting told you have to wait months, or, oh no, we don't take your insurance, or having to pay hundreds of dollars up front. But this is not just something to envision. This is a reality for thousands of Vermonters, where mental health continues to be a luxury. This is a systemic issue. Because they don't have an adequate amount of money, or because they live in rural areas, the system's eyes skip right over them. But our eyes must not skip. Mental health should be a right, not a privilege. This is a crisis. It is happening the most to the people who have the least. An issue that many like to ignore and treat as if it's nothing. The help is far, the availability of services are limited, the cost is taxing. Low income equals low access, and low access equals low hope. This feeds the cycle of homelessness, substance abuse, and poverty. But this is not just a system failure. This is a moral failure amongst us all. This is an issue where we all must come together to fight. Help should be a right, not a privilege. If resources were less expensive, or there were more funding for proper care, people could get help even if they had no money, communities would thrive, and people would stabilize. But in order for this to happen, that means support and filling the 20% vacancy gap rate for mental health professionals in Vermont. People need access in rural areas, or even telehealth services that are less expensive, or sometimes even free for first-time users. But what if the complete opposite was happening? We had emergency rooms full of people who were going through mental health crises, more youth walking down the wrong path, more incarceration than ever before, full of people who needed care. None of them needed to be punished. Only this is exactly what is happening in Vermont right now, but you may not realize it. Our silence only makes this crisis worse. Help should be a right, not a privilege. Our voice starts now. We must advocate for these rural areas suffering because they have nothing. Places to get help are 30 minutes or more away. Since the cost of living is also rising, we must fight against the unbelievable skyrocketing costs for mental health. But there is help and hope. You can help by supporting a nonprofit organization like SASH. SASH is a program for people on Medicaid. Individuals of all ages can get help if they have a disability, need housing, or mental health services. This is an important organization because these are the people who feel the most stuck. They help with housing, a burden that can be lifted off everybody's shoulders, which helps improve their health. It has helped over 5,000 elderly and disabled people, and also partners with 70 organizations to ensure it is spread all over the state. To help, you could donate any amount of money to this organization, but the thing is, many people are not in the position to donate. Although SASH is a start, it leans more towards older people, so it will not solve the issue for many. But you can be a support to your friends and your family. You can check in and ask how they are, encourage them to keep reaching out, but also encourage them and your community to fight for this ongoing crisis. And it's hardworking people who do not get much in return. Help should be a right, not a privilege, for them, your friends, your loved ones, and for you.